thank you guys again for coming on Let's Again. We're here on Smart Food team. We have Sarah, who's one of our patient care coordinators, and Nicole, and also obviously Dr. Williams. And then a special guest, Carrie. She's had her facelift already, so she's here to kind of share her story. And if you have any questions for her, feel free to ask. We'll wait for that until the end. Without further ado, Dr. Williams.
Come on in. I want to get out of respect for everyone's time. I want to get started. There's always traffic and people, so we'll just make sure we walk around. And I got to thank Lexi, who did an amazing job. I think we had something like, I don't know, 90 some people, a lot of people attending virtually. So I want to just acknowledge our friends that are there, people from Vermont, Colorado, San Jose, Massachusetts, Michigan, New Hampshire, Tennessee, Virginia, the western part of the state, Buffalo, and Chicago, and San Antonio. So thank you all for attending. And we'll have this also right. This will also
be on our YouTube
channel. And so it's nice nowadays. There's so much we can do virtually. I have a ton of YouTube videos online all about this subject for people who are trying to just maybe begin their journey and try to understand. Stand up. This one.
Yeah.
Okay. So, yeah, I mean, Lexi put this together. It was kind of cool, a fresh reflection. Basically, we're starting spring, and let's start over, kind of thing. But, so here's what we're going to talk about tonight, just a little bit. I'll let you know who we are. We are a destination practice. We have people coming from all over the place, and it's really the procedure that I've been doing now almost for about 15 years. I've been doing facelifts for 35 years, 34. And all I do is facial work. That's it. And so that's what we're going to talk about. What is deep plane facelift? In my professional opinion, I think a lot of people say they're quote doing it because it's somewhat of a marketing term. But the reason that the facility lift that I will do is there is no comparison with how natural the results are, how impactful they are. And how long lasting they are, and same thing with recovery. I'm going to talk a little about, how do we do consults, what do we do, and then what's the scarless technique? I mean, again, you hear some of these things out there, hyperbaric oxygen, scarless technique. I wanted to shed some light on that. For those who are joining us from a distance, we do have a lot of people that come from out of town, and our patient concierges really have this down to a science. The one patient today I had was the husband and wife's team. The husband had his surgery on Tuesday. The wife had it today. They were from Naples. So we're by the airport, so we have a lot of people coming in. And then I'll have a little question and answer session. I think Lax's got a few giveaway things for people. Took the time to come here. And anyone who's here in person, there's no charge for a consultation. We figure in saving with books, you guys have a book. I mean, anyone's taking the time out of their busy lives to be here. We just want you to know we appreciate that. And I think that I encourage people to get as much information and education as possible. No one really cares about this, but always, people always want to know that you got some credentials. So I've been around. I'm a clinical professor at Albany Med, on the clinical advisory board of Alpha Step Partners. I've been former president of my national academy. And I'm an upstate New York guy. I just decided I do want to live in New York City. So medical school in Buffalo, upstate for my residency. And then I went to Chicago for my facial plastic surgery fellowship in 1991 and 92. So I've been here for a while. 30 plus years experience, over 10,000 procedures. And so this is pretty much like all I do. I do some rhinoplasty now and then because a lot of our patients, it was where I started my career. But facial plastic surgery is where we're at. Just a little bit about who I am and my, feeling. I've got ADD, I guess. So I've got all kinds of things going on that I enjoy doing. I do love my family. I've got 4 kids and 2 daughters that have been married. Dr. Lee over here on the right is my daughter, and we were dating freshman in college, and now he's my partner here. It was just nuts. Like he went through all that, and then the rest of the gang here. My wife who puts up with it all. I'm a pilot. I'm almost completed with my instrument reading, and I also love agriculture. I have a little vineyard, and so what do I mean when I say we're a destination practice? when I first went to practice, it was always my plan to build a destination. I thought if people were good enough, people would travel. I know I will go 3 hours or 4 hours or whatever it takes to find who I think is the best. Someone I think is honest, someone I think is experienced. Um, I'll make that trip. And so I was bold enough when I was in practice for about 6 or 7 years to find a piece of real estate by the airport, 1997. So coming up on 30 years. But that was always my vision. And we have our ambulatory surgery center, we have our operating rooms downstairs. And when we first moved into this building, it was just me in this little space down here. The Williams now Center built the whole building now. So we have Dr. Slaughter doing hair transplant. We still take care of insurance patients. We have a lot of patients we really pretty much have dominated this area for reconstructive surgery and skin cancer. So our motto, credo, is take care of each other and take care of you. We have amazing people. Most of our people have been here for decades, or many, many years anyway. And we really, that's what we do here. We take care of our team and they take care of our patients and people can feel it. And my goal always in my vision was really to deliver world-class care and make it worth people coming here. You don't have to go to New York City. In fact, a lot of our patients come from the city. A lot of the doctors come up here and watch me do surgery. So in Little Albany, New York, we do have an on-site, fully accredited, New York State inspected ambulatory surgery center. And we went through our first round of accreditation in 1998, and every 3 years since then. So I think it's like 10 or 11 rounds of accreditation we've had. And we just recently went through that. So we just got our 3-year accreditation again. What's cool about it for me is it's a very private situation downstairs, one-on-one nursing, take care of my patients when we're doing surgery. You're not, herded off in the surgery center. We've got a nurse to every 6 patients and got a gallbladder patient next to my patient. So not that it's just that I want to make sure the attention to detail is there for our patients. So and we've just had really high ratings from our patients. This little video was a video I made during COVID because people at that time were really worried about safety, right? We all were. Still had the same standards of care, safety that we have in the hospital, but I really didn't feel that the hospital was serving our patients in a very private setting as well as we can do if we had control of that. So we went through the AAAC accreditation agency, which is also Medicare approved and inspected by the New York State. That's right below us. Fully compliant facility that has backups for everything, backup generators, backup systems. We have 25 air changes an hour with 5 fresh air changes. I'm proud of the fact that I've never had to transfer a patient to the hospital. But we have transfer arrangements and all of those things that apply to the high standards of care. The team that I worked with was kind of like an orchestra. When I'm doing a surgical procedure, I literally put out my hand and my scrub tech will do would be good 20 years to know what instrument I need. And that's a huge advantage. As a surgeon, it's also a huge advantage to the patient because we're getting the same team every single day. So consistency of care, privacy, and safety is there and is unparalleled to what I am able to achieve at the hospital. We basically take care of one patient at a time and they get one-on-one specialized care with specialized training nursing and our whole anesthesia team is dedicated to the cosmetic patient. One of the other advantages of having a fully accredited ambulatory surgery center that's just dedicated to special. So I just have there. A lot of people don't realize how, for me, it's a luxury to have that downstairs. I did 32 facelifts today, and I literally do the surgery and I put my hand out, and my scrub tech knows what I want every step of the way. It's crazy, right? But what that does, it saves. I had a patient call here once and talked to Nicole and said, I don't understand. I've been checking around to different surgeons around the country. They say it takes 6 hours to do a deep plane facelift. Yeah. And I do it at about 3.5 to 4. Why? Because I got the steam. So think about this. You get different anesthesia in the surgery centers. You get different team, different nurses. I work with the same people. Why does that translate, in my opinion, to better patient care and make it worth the trip to people? Because if it's my mom or my loved one, I'd rather have them on the table for 3.5, 4 hours versus 6.5 or 7. And it does make a difference. It's the same thing with anesthesia. Our patients are up, awake, and out the door in about an hour. And so they rarely do we ever see post-op nausea and vomiting. I know that doesn't sound like a big thing, but it's a big thing for me. I don't want my patients feeling sick. So I want to just talk about the fundamentals. This video on YouTube has gotten a lot of traction. And the reason why is I made this video a few years ago because there's so much confusion. What exactly is a deep plane facelift? And there's people using it, in my opinion, just as marketing. And no one's really explaining it in a way that's non-graphic to the patients. And I have a lot of teaching YouTube videos for doctors, but this one here I think is pretty good. So I'll let you go ahead and just listen to it. Represents the skin, okay? And underneath it, you've heard this word SMAS. That's the submuscular aponeurotic system. And that is a layer that is contiguous with the platysma, the muscle in your neck, and up here in the temporal parietal area. But basically, this is the fascial layer that we work on. Now, on the skin surface, you see a jowl, and you see some deepening of this nasolabial fold. So when we do the surgery, the traditional surgery, you lift up the flap, you see. Actually, the older facial surgery is just pull the skin. But as you can see, with this wrinkle in the underlying SMAS, just pulling the skin tight is not going to give an effective elimination. You can still see that bump in there, just like having a pillow in a bed, right? So I'm going to pull this over here. Let's assume when we're doing surgery, we are reflecting this. The most common technique used in the country is what's called an imbrication technique. And what that means is we take a little strip out of this mass, and then we tighten it a little bit, and then we lay that back down and we lay the skin down. So I'm going to show you what that looks like and why that's different from a true deep plane lift. So I'm going to go ahead and just demonstrate this by taking a little strip of the SMAS out. I'm going to get a hold of it here. Okay, and so here I'm taking this strip out of the SMAS. Got Dr. Rhodes up here chuckling. It's like church, you know, I'm so some of that. Right? It was strip out. But this is another layer on this. Is again probably the common just way to do a facelift in the country. It's the way I did facelift for 20 years. This is called an imbrication. Imbrication. Now, you can see that you can actually tighten this SMAS up. Okay, you can tighten the SMAS up a little bit, but the problem with it is there's resistance on where the ligaments are, and when you pull the skin back, you're still going to have a little bit of a lump. Okay, it's not as effective, I should say. There are people saying they're doing a deep plane lift, and what they're actually doing is they're kind of going into here and they're spreading. Okay, they're spreading this tissue to try to release this a little. But a true deep plane facelift, and I'm going to show you this, carries this dissection further up here. Okay, and cuts these little ligaments. And I'm going to show you something. When we cut these ligaments, okay, all these little ligaments here, and you cut these little ligaments up here in the face, and take this down further into the neck, which is what we do now with our deep plane lift. I want to show you something. Look what happens to the SMAS. Okay, now we trim this all, and then look what happens to the jowl, and more importantly, look what happens to that jawline. Okay, and that's what you'll see as patients. You'll see the big improvement that you don't see in this direction, but more importantly, you get all of the tension on the SMAS, repositioning things back where they should be, because this SMAS is what stretches out. We trim this. I'm not going to bother to show you all that right now in the interest of time, but then the skin really redrapes, and it's a much more youthful jawline. It softens its fold and addresses the mid-face. So I hope that's giving you a little bit of an understanding. The other thing is there's no tension on the skin, so the incisions are a lot less perceptible, and I'll show you that. I would encourage you to really ask your surgeon if they're releasing the ligaments and repositioning, reposition. So I'm going to go through some before and afters. People always ask, what are, and our team here, our patient concierge will go through whoever wants to know. So there's basically three fees. There's a surgeon's fee that covers it, and then there's a facility fee, and there's anesthesia. And it's very much like anywhere else. But Nicole and Sarah do this every single day and work with patients. And certainly, if you want to ask, privacy, ask some questions. But we don't have any secrets or fees or what they are. And this is Sarah and Nicole. They're extremely experienced. They can almost probably answer 98% of questions, and if there's 1 or 2% that they can't, they'll always pass it to me. And typically, within either 12 or 24 hours, you're gonna have an answer back. Because people always have different questions, and these two are with you from the beginning to the end, and that's kind of cool too. Because you have obviously you have a nursing team here, but you have someone who's kind of like your quarterback for your care. And it, again, maybe a little less of an issue for people who come from in town, but people who come from out of town often need a little assistance with whatever. So, and they can really kind of get you focused on what are your goals. We do have a lot of, we have our nursing team, and we also have our nurses will also work with patients that come from out of town. We require people to go home discharged from here to a responsible party. And so a lot of our nursing team, they work as a nurse's companion, and they'll basically go to the hotel because a lot of people we want them to stay here. We have people who will come from out of town, planning to come here. We'd like them to stay here for 8 days. People who are driving distance, say Boston, Vermont, there are a lot of people from Boston, Vermont. They will come here typically the night before. They'll have a procedure. They'll stay maybe 1 night or 2 and then go home. And a lot of times they'll take advantage of our companion care team that will stay with them. You really don't need a nurse there, but these guys do this stuff every day. So that's kind of cool because they're good at it. So one of the things that I think is really important to do, and we do with every single patient who's considering lift, because at first I ask questions. I ask like, what are the things that bug you, and then we go through that, and I kind of give them, my thoughts and recommendations based on what I see. But we always do computerized imaging, and when I typically tell patients when I morph and show them what I think we can accomplish, I tell them a couple of things. One, you get a couple promises from me. One is that my honest opinion, tons of experience, and best ever, but I'm not going to show you something I don't think I can get really close to. And I think that's really, really helpful for me. And it's really, really helpful for the patients. So I get a really good feel if someone's expectations are realistic. Some people are not good candidates because they want more than I think that we can accomplish. It really isn't the majority of people. It's very small minority of people, but most people find this process of going over imaging very, very helpful. People always say to me, well, when's the right time? How do I know? And most of our patients are typically between about mid-40s and 70s. What I tell people is, you'll know when you're ready. You'll know. People come in and they say to me, my neck's been driving me crazy and I'm ready. I'm like, I'm tired of looking at it. I want to be able to do it and enjoy it. How long does it last? I typically tell patients they're going to see about 12 to 15 year step backward. Now, some of them 40s, you'll see some of the younger patients here at 40s, they're going to see less improvement, but there's also some of the most gratified patients too, because the impact is really starting to make them crazy. So typically I tell people they're going to get about a 12 to 15 year improvement out of it. Okay. So recovery process. So the procedure typically takes, depending on how much is going on with someone's neck, typically between about 3 hours and 15 minutes to about 4 hours or so is what I usually schedule for the lift. It's done under anesthesia. In the post-op period, people will have kind of a dressing, a wrap, and they will just tell me that it feels tight. So we've eliminated narcotics, but then patients do better without all the drugs. Quite frankly, we've eliminated routine antibiotics. I'm tired of people 4 days out, they got diarrhea, and there is no real statistical benefit of putting people on antibiotics. In fact, what we do is someone has some area of redness, then in the post-op, we'll put them on something, but we've eliminated drugs. narcotics, antibiotics, for years I've not even been using drains. And our patients do so much better without this. No one wants to carry the drains around for a week. The dressing is only on for about a day or so. And then the sutures are cleaned for that first week, but they come out at day 8. People always ask me, well, when can I go out in public? And I tell them typically somewhere between 10 days and 2 weeks. If someone has a heavy neck, I may say a little longer. People feel fine the next day or 2 days later to do the work and on the internet, laptop. So this is a recovery video. It was a patient made of ours.
Hi, my name is Corinne,
The
and
very next day.
I'm 3 years old, and I just had a deep plane facelift yesterday afternoon. So I am less than 24 hours, no tubes. I look like a sumo wrestler, but I feel great, and I'm very excited about my new chin and the contour.
You can see she has a little bit of a bruise on right. Most of the time.
Hi,
we
it's
get that.
Corinne
So
again.
you might just
3 days post-op, and I just came back to the Williams Center to get cleaned up and have my bandages taken off. I have to say, yesterday was probably the hardest day.
Most
As far
hardest
as
day,
being
2
the most swollen and most uncomfortable. I wouldn't say there's a lot of pain, maybe like a little twinge here and there, but it's just mostly
I'll stop with that video for just a minute. This video here is online too. It goes out like 3 months. You can see her like at a black tie holiday party a couple months later. So here's another one. This is someone just a little older. She's in her 50s.
More than the results are what for you. And the recovery is no worse. I mean, you're 1 day out. It's impressive. Have you seen your neck yet? Or
not.
Okay, here you go.
She had like going on.
Check out the jawline.
Oh, it's great.
And I know your daughter's only concern is that she loves you.
I'll show you.
But this she looks back. These sensations will happen. Everyone understood that. So here she's day 2.
6.
Hi, I'm day 8 post-op. We've had my
So that's day 8. You can tell, see, she's still a little swollen. It's day 90. She's still a little swollen. Day 20. Started to really look like herself. And she had fun. She sent us all kinds of pictures.
Facelift, feeling great, despite, celebrating my 6th birthday. And just surprised with my entire family, I didn't look like I was 50.
And so, and again, just to point out for me, what's really important is that these patients look natural. And I think she looks really natural. You would never know that that was all there. And you can see these issues they're pink, but I'll show you some up close in the ear. They're hard to find. So come to ask questions. We talked about the recovery. When can I turn to back to exercise? I tell people the first week you can walk to your heart's content, exercise. Week 2, maybe walk on a treadmill and that sort of thing, or maybe some light free weights and stretching. 3 weeks to 4 weeks, no restrictions. So people who are really into Peloton or whatever Orange Theory, they can work to their heart's content at about 3 to 4 weeks. As I told you, the main thing people tell me, it's not like choking tight, but just that first week or so, it just feels tight. And when can I go out in public? I already told you that. Public events, I usually say 3 to 5 weeks. Mother of the bride, give me 2 or 3 months. I don't want to be stressed out. Just because, there's rehearsal dinners and all this other stuff. So one of the things we added on now, all of our patients getting, we really are focused on the patient experience and trying to make it as easy as possible. All our patients get lymphatic drainage to help support the healing by Nico. She's amazing. Anyone who knows her, she's been at this a very, very long time. So here's kind of one of the other patients here. She used before 1 month and 7 months. And she's continued to send us photos as well. Looks terrific. She told me I felt like I look 15, 18 years younger. And nobody would know. I mean, if you look at her, no one would know that woman had. And so what I go on record saying over and over and over is there's a role for fillers. But people are overusing fillers. We see them all over. When surgery is done well, you can't see it. And that's the thing is you'll see the good stuff, right? Because, so this is a little video we did with Rose, and this is where I
Right
died.
up in the hairline. And I beveled that incision, so the hair after the surgery actually grows right through that incision and makes it almost imperceptible. Then what I do is I come back here and go behind this thing called the tragus. So you really don't see this incision. And then as I come out behind the tragus, I come down in here in this little creep, because we want to get all of this in the neck. Actually come right up on the back of the ear here where you don't see it. Okay. And then I come across about here. And then I dot right down in the hairline. And the same thing as in the front of the ear. If we bevel this incision here, the hair grows to it. And that's how we make it basically imperceptible.
Initially, it's pink, so then when the hair grows, so it's
someone can
hard
also
to see.
the hair up in the ponytail and not be able to see that incision.
You may see or hear people talk about the scarless approach, but I actually, one of the patients I did today, I use this on her. It's really not, it's not an incision less lift, but in the area of the hair. And certain individuals who don't have a lot going on, I'm able to do that. Like I said, the one patient today had very thin hair in this area, so I opted for it. She and I spoke about it, but
Somehow she doesn't have a lot going on.
I did this Carlos.
And we're really looking to maybe join. I can take this incision out, and rather than come out here, I
You
actually
can't do it on everybody, but that's when you hear
And
that.
allows me to get over down into here, but without having to move out. But it is important to really pick your patients correctly, because if I have someone who has a lot of tissue that's moved in here, we can't do that because they need to move.
So this one is one I use the scarless technique on. And again, just as a second, this cheekbone, the cheek has been put back up here. This has been softened, jawline much cleaner. But and her incision comes just like this, but that is in the hair. And so she can wear her hair back and never see it. Most people, even with the incision that when I have to put it out in the front, which is most patients, it's still pretty imperceptible. Now, here's a woman that I had, she had thick hair. I knew we could do a good job of this. You're starting to see some of the hair grow through, but this is basically just going to disappear over the next several months. This one I did do the scarless approach on her as well, but again, heavier face, and just here's really the big area that the deep plane fixes. This is put back up here. Okay, softens this whole region because this has all been released and repositioned, and then of course the neck. The other big thing about this approach that I really appreciate is that patients tell me, I love my face, but I absolutely love my neck. And I have people come in and say, I stopped wearing jewelry because of my neck, and I want to draw attention to it. I think she was 49 years old. I think she looked very, very natural. Nobody would know looking at her. She had lip. Also did her lower eyes as well, but she looks very, very natural. And here's her profile view. Another patient, she had fun with it. She sent her all of her kind of a sequence, and actually, I think she's got her kind of her journey that she documented, put out there in YouTube for us. Here she is. But again, it's really a much cleaner jawline. A lot of this tissue gets moved forward. It's not a drastic result, but it's a very natural result. This was another patient that I used the scarless technique. Unfortunately, with her, she didn't pull her hair all the way back, but suffice to say that is completely hidden. But this was really starting to bug her. She said, I just feel like I'm looking much older than my age, especially in my lower neck. And she's a good 59 years old, so it wasn't a drastic improvement, but it looks very natural and accomplished exactly what she wanted. And she sends us pictures from time to time. I think this one she took in her car somewhere. This was actually when she came back. She wanted to just share.
I did take day-to-day photos just to compare and see the progress. Just recently, I was in the grocery store and I had a hat on. I had my hair pulled back, and I realized that I wasn't afraid to hide behind my hair. I wasn't afraid to show my profile. And I didn't have a turtleneck on. And I was proud. I
I could not be more happy with my results. I know that I did ponder over it. But I knew that I always wanted to do it, and I feel like if you're younger, not that I'm young, but if you're younger and you start to see these signs, I feel like it just gives you back your youth in a way, and it just do it. You just have to do it. That's it. You'll be thrilled. I would definitely recommend Dr. Williams to my friends and family, and I already have.
I think that's what makes my job fun because it makes big impact, not in how people like look, but how to deal with themselves. Here's I think this is the one that you saw in the video, the first video. This is but you can see, again, I think she looks very, very natural in that photo. Same thing here, not a drastic result, but a very natural result. Here's that other one you saw long term. You can start to see now her hair is growing through that incision, and that becomes less noticeable with time. I think this is her video, right?
Tammy, and I think it's like, I researched the reclaim face procedure for approximately, we did a lot of research and Dr. Williams' name kept coming up. For the surgery, every time I walked past the mirror, all I could see was just this version of myself that I didn't feel comfortable with. And that was really what was the catalyst and caused me to come in. Surgery day was very interesting. I really felt like I was going to be really nervous coming into it, and I wasn't. I was very relaxed. The atmosphere was nice. Everybody was extremely friendly. It was a great day, really. I think on the front end of it, on the back end of it after the surgery, it really wasn't bad. Honestly, it was a day after that there was a little bit more of the feeling that it was a little painful. The recovery is not amazing.
And this is Kevin. This is how long ago was this?
4 years ago.
4 years ago. Yeah, so we did her lower eyes and we did her, but you can see what it happens. I mean, I got her now, right? And but yeah, that was kind of for her to stop by and just if you guys want to ask her questions afterwards. It's this patient. Yeah, she gave me a little Williams in her tie that I work from time to time. But I'll talk a little bit about the heavier necks because we do have some people with pretty heavy necks, and it's just it's a little bit more work. That was her. She was thrilled. It's a harder. I mean, it's what I do, but it's definitely a little bit more work when we have a big heavy neck. This one that we've seen her photos, and her neck is a little heavier, but nonetheless, I still think it looks extremely natural. And here's her video. I mean,
My name is Helen, and I'm 64 years old. After my surgery, I had to attend an event, I will say, where there were many, many people that I ran into there from my previous job. I was a teacher, so many of my students and my colleagues were at this event. Received many, many compliments, but the best compliment I got was I ran into Dr. Williams, who came right up to me and said, "You look fantastic." You can't even tell anything was done. You just look more relaxed, or you look just more refreshed.
65 is going to be a more significant, more dramatic result than a 45-year-old. I think she looks terrific for her age. She was actually, this woman here was actually a friend. So I was telling you today, I have a husband, wife in town now. I've had sisters. I mean, I had a mother that I did her first facelift 15 years ago, and she and her daughter were getting one together. So I've had all kinds of combinations. This one is a physician, and she and her buddy came down from Plattsburgh, and they both built that facelift at the same time. I don't know. It's kind of fun to do, I guess, that way. That was her buddy that came down with her. She had a heavier neck. Definitely more involved, all down in here. But again, I think she doesn't look old. She doesn't look tight. She looks natural. Nobody would know that woman had and these patients are very gratifying for me. Heavier neck. These are tough, right? Big, heavy jowls, square, heavy neck. But again, I think she looks extremely natural. And she was 69. She came down from Vermont,
Until for a follow-up and
and then I just one or two more last one. Here's another, but 1 month post-op. Again, I think real nice improvement. See, we were never able to get this kind of collection before I did the deep painting. And then another woman, she had a heavy neck. But I think she looks great. This woman is a little older too. I ended up doing the CO2 resurfacing on her with a lift for all that wrinkling. And you're not going to get the wrinkling to go away completely, but this is a more significant recovery period because I did the lift and then the CO2 at the same time. But I mean, look at that. Look at that improvement or correction. It's a very nice thing. A nice result. 74-year-old. So again, I have a lot of people in their 70s. You would think that, but as long as people are healthy, it's not a problem. It just depends, on your. Now I don't have as many dudes, they and the guys that come through, they don't, obviously they're much more private. And again, he just, he was tired of all, this age and gear and the neck. But I think he looks very natural. Another heavier neck, more dramatic result. Not 20-year-old neck, not a 20-year-old face, but one that she's happy with. Another 76-year-old. Well, let's back up. So I just want to thank everyone for coming. What I would tell you is Lexi and I put a lot of information on my Instagram. It's all educational. So people are, I try to talk about some of the challenges and all of that. So if anyone who's interested, follow my Instagram. And then I have a lot of YouTube educational videos, like from start to beginning. Those people, I don't know that I would want to watch the surgery if I was, but I do have a lot of people that want to watch it. I have physicians who come through. I had one yesterday came in through here with his spouse, and he wanted to see the surgery. So go for it. So I used to put those out there really just for teaching for other doctors, but people do believe it or not watch it. So let me just stop and I'll take some questions. I'm sure.
I wanted Terry to share her story a little bit. This one as well.
Yeah, I had the procedure done 4 years ago, and I didn't do it out of insecurity. I did it intentionally. Just wanted to look the way I felt inside. I had not quite as heavy, but it was quite a bit of excess skin here, and I was worried about scarring. I'm a critical care nurse, and I worked in that very same going downstairs, and I worked for the health department, so I do understand the handoff. Before you get into the role, there's a lot of things that you don't have control over without having your own operating room. So I welcomed the opportunity to do it here. I know some colleagues that raised the eyebrow, but basically I had no concerns at all. The surgery went well. I went home the same day. My daughter stayed with me. So really, I didn't need any pain medicine or anything, just patience. And patience not to go out. I waited maybe 5 days before I began venture to die. But a little tightness, a little numbness at times. I think the first week smiling, I kind of stayed away from anyone that would provoke a lot of laughs. So I didn't see my ex-husband for 2 weeks. But anyway, it worked out well for me. But there's not a day that I'm not thankful for the surgery. I love the way I look, and in turn, it makes you feel differently. I became an author, and I'm a lobbyist for the Heart Association, and there's a lot of things that I just felt like, not that appearance, I was so fixated with it, but what a joy to be able to look the way you feel. I'm 63 and I don't feel that, and then my hobbies and friendships don't reflect that either. And it's important to say yes to yourself. I spent my whole life making other people appear taller than they were, enhancing children and just being there for everyone. You can understand as a nurse how much I gave of myself, but I never once thought that I needed to give to myself to be intentional and be part of the scene. So I'm telling you, I don't regret it for a minute.
So just to let I hear this sometimes, people come in and I can't believe I'm here. I kind of feel almost guilty a little bit. Did you ever feel guilty or not?
I never felt unworthy for saying yes to
That's
it.
I like that.
Yes, there wasn't a time where I felt the need to apologize for the fee. I launched my children through college and I worked hard and I saved hard and it was worth every single penny. And I'm not extremely wealthy. So it definitely, I had to think about what I was doing, but I'll do it again. Exactly the second that I'm done. So guilt, no,
Appreciate it.
Yeah.
Time and stopping by.
Was anyone have questions?
Yeah, I have a question. I'm reading so much about, people having numbness for quite some time. Like a month or so, and that was always a big concern and, they said they can't feel their cheeks for a while. That can,
Well, I think that would be an individual situation. Yeah.
And, some people say from few weeks or a month or so. I've had people that tell me that they're still a little numb several months later. It does, sensation comes back, right?
Yeah, absolutely.
Here's what it is. There are these little tiny sensory nerves. It's just the way we're designed. They're so small that when I'm doing my surgery, it cuts through them. And then what happens is they just grow back. But it takes some time. I would say the average person is probably a month or two. Not like the whole face. It's just typically this area, right? This is the area.
Yes, yeah, I think around here and a little behind here, just a little.
Yeah, a little bit behind the ears. Yeah.
Now, how is what you do with the deep plane different than, because I've seen where the snaz is cut
Mhm.
and then pulled up, either sutured or folded.
Yep.
And then brought up.
Yep.
So yours, you go in and actually cut the ligaments and then fold everything.
So, yeah, it is a little confusing. So
Yeah.
I cut through the smas.
Yeah.
The smas is, and the older technique approach that we use for years, take the smas and you just fold it over.
Right.
The difference between the deep plane is you go below the smas. And you don't just I told you, people put scissors in there, just spread. You're actually thing below the smas is what's called an avascular plane. When we were developed in embryology, a tissue folds together. So in that plane, it's a natural separation. So there are no blood vessels in that plane. The only thing there's holding that soft tissue in certain areas where these tiny little ligaments are. And when you release those ligaments, you're able to really move it. And that's what allows to move the whole mid-face. There is no question, okay, it's not for a rookie to do. And I've never had what I consider major complication or injuring the nerve or whatever, but, because I have patients who come in, went to my doctor and he said, he won't do that surgery. I said, well, listen, I respect that, but I've done, thousands of facelifts. When I first started to work with this in 2010, I went back to the cadaver lab for weeks and basically did the surgery of cadavers. And so it's a more advanced lift, but in my opinion, there's no comparison to the results that I had years ago. And at this point, it used to take me a lot longer to do it, but at this point, it takes me just as much time as it used to. And so, because between the results that I'm getting with this, how natural it looks, and that's the thing, when you release that, you pull everything tight and trim that mess, and there's no tension on the skin. And so what widens a scar is when there's tension. So that also allows us to move more tissue, trim more tissue, but also do it in a way that there's no tension on the skin. So I don't know if that answers your question. Yeah.
So you mentioned you did underbelly
Yes.
as well.
Yeah.
So how much does the deep plane kind of take care of that versus?
It's a really good question.
yes.
So the patient that I did today, she will get a very nice improvement in her lower eyes, and I didn't even do her eyes.
Yeah.
Because, so if you think about this,
Mm.
an aged eye is a more elongated, deflated eye. So as I'm tightening up that tissue in the deep layer, you're creating a shorter, fuller lid. And that's exactly what we're doing with the deep plane lift. And that patient that I did today didn't, I didn't necessarily do a blepharoplasty, but her eyes were. Now, there's a difference. If I have someone who has a bag, puffies, I take those bags up from behind the eye. There's no, so it depends on the individual. No, some patients I have to take I have to do a blepharoplasty at the same time to get that. So you're still gonna get this tissue moving up, but if you don't address the puffiness, well, you're still gonna see that. Yeah. That makes sense.
Yeah.
Yeah.
Yeah, you had said, so you're 4 years out of surgery, right? So do you feel like everything is still kind of right where it was right after surgery, or are we starting to see 4 years of, age?
You're gonna see 4 years of aging.
Is that you're just
That's
kind
what-
of starting seeing it?
Slightly, I think there's a slight little wrinkle coming here.
Here's what I tell people, we're moving in back, you got this 18 and variable, right?
Yeah.
You got a twin sister. Okay, you get out here, you're back here, so people say, how,
Just naturally
you're gonna
from that
continue to
point.
age.
Gotcha.
Actually, the best results are about 3 to 6 months. And then you continue to age, and then you've seen
Yeah.
4 years of aging, but it's unrealistic to think that we're not gonna age, right?
Right.
When do, again, I've been doing this long enough, when do my average patients come back? People always say, oh, I'm not gonna want one, I'm not gonna care, and then they do, 15 years later, they come, but the average person who comes back and has another lift would be, is somewhere around 15 to 20 years later.
I always tell people, like, turn back the clock, it didn't stop.
Exactly,
Exactly.
Yeah.
that's exactly. what
And I
it is.
like you look great, like you really do, so I can see how you're saying it, you feel like. You now look like you feel, like you don't
Yes.
feel your age,
Yes.
you feel, we always think,
And one of
we
our,
feel younger.
it's such a luxury to feel that,
Yeah.
too, because it
Yeah.
changes everything. It's a game changer. Yeah.
And can you touch on anesthesia
Yes,
and,
so I use generally for 20 plus years, I use sedation, which is like you do when you get a colonoscopy. But about 10 years ago, I switched everybody to a general anesthesia. And there's a reason why. First of all, our team is really good about not over treating patients. Second of all, I'm doing this very delicate surgery. I have enough gray hair. I don't want the patient moving around, and I just can't feel good about, because I know I've been there when patients are moving around and you're trying to get a suture in, and it's just not ideal. And so, quite frankly, 3.5, 4 hours of a deep sedation is a general anesthesia. Just semantics. The difference is you got a breathing tube in for someone. And I believe that the general anesthesia probably saves at least half hour, maybe 40 minutes, maybe even an hour off because the patients are moving and I can get my work done. And if it's my loved one, I want them off the table. So the other thing with sedation is once you get it beyond about 2.5 to 3 hours and they're using some fentanyl, which is what's used all the time, the incidence of post-hypoglycemic vomiting goes up. And I don't want my patients throwing because not only do they going to bruise more, but it reflects on their patient experience. There's nothing worse to me. The patient's experience is flawless, and all they remember is puking the first night. So, I tell patients, listen. I just feel when patients start dictating care and telling me how to do anesthesia, it's time for them to find another doctor because I'm going to be taking good care of them. But the general anesthesia, the way I do it, is the best patient experience I've ever had. I have a transfer arrangement with Albany Med. In 30 years, I've never had to transfer a patient to Albany Med. Not once. So, but I also don't take chances. So just like when the plane's sitting down the end of the runway, you don't take off until a checklist is run and everything's good. So, but that's why, that's why it's that way. But we follow all the same standards that I do in the hospital. Exact same checklist, is exact same everything. So, and that's how we keep it safe. But if someone's not healthy, I'm not going to do their surgery. So yeah, I use a general anesthesia. I hope that answers your question.
thank you.
It just people get hung up on the general anesthesia thing, and like I said, I'm focused on is the patient experience. I want this experience for them to be as pleasant as it can be. You're still having to. The one thing that is different about this versus having a gallbladder, you take it out. It's something to look forward to. There's nothing fun about having your gallbladder taken out. So it is a more of a happy experience. Yeah. Any other questions? Why don't we do this? I'll let you guys, kind of grab something to drink, eat, drink, or ask questions. Did you
Sarah
say something?
Nicole,
Oh yeah,
Sarah Nicole are here.
Guys are the best, and they will, any questions like tonight or down the road. Think about going down the road of that journey. You want to ask these guys a question at some point. Use them as a resource to reach out. But they're pretty knowledgeable, right?
Yes.
That's Sarah. That's Nicole.